Do you have hemorrhoids? Now that it's just the two of us, let's talk about what you can do if you have hemorrhoids to heal faster and prevent them from coming back. The number one thing with preventing and also dealing with hemorrhoids is to prevent constipation. This may mean that in the short term or even long term, you may need to use motility agents or laxative agents, increase your fiber intake, modify your fiber intake, and work on your hydration. The more constipated you are, the more straining that you may do, which will create hemorrhoids. And the more constipated or large your stool is, the harder your stool is, it's going to be very painful to pass, and that's where you may get more tearing or blood from those hemorrhoids. The second thing is to improve your toileting posture and behaviors. Toileting posture will allow you to have easier release of poop, meaning less straining and less pressure on all of that sensitive tissue surrounding the anus that will then cause hemorrhoids. Ideally, you want to lift your feet so that your knees are elevated above your hips, lean forward slightly, and relax your belly. And with your toileting behaviors, it's important to not sit on the toilet for long periods of time. Your toilet bowl is open, meaning there's no support for your pelvic floor, and again, all of that tissue around your anus and that sphincter. And so if you're not actively going, ideally don't sit on the toilet more than 5 minutes, get up and come back when the urge hits again. And then when you do get an urge, make sure you respond to it. If you ignore your body's urges to go, that urge is going to get quieter and your body's going to learn to hold tension and hold the poop in, meaning you're going to have to push harder and strain to get it out, causing hemorrhoids. If you do have active hemorrhoids and you're working on healing, you want to make sure you keep things clean down there. That will help prevent infection or irritation. One of the best ways to do this is with a bidet or a gentle cleaning wipe. There are wipes called good wipes that you could use that are butt friendly, but then there's also at-home bidets that you can use. I use a Tushy in my house and love it. For more healing, you can also use a sitz bath or even topical medications or creams that your doctor recommends. A sitz bath is something that you can do yourself. This is a warm, shallow bath that you can sit in to relieve some of that pain and discomfort. And then on the healing and prevention side, increase movement and exercise. This may not seem directly related, but whenever you are more active, you're stimulating more blood flow and motility for your gut. You're also strengthening and creating more flexibility and health of those pelvic floor muscles surrounding the rectum and the anus, which will help with easier passage of poop. If you struggle with this, a pelvic floor physical therapist is a great resource. And there are some cases where hemorrhoids may require surgical treatment or more intensive treatment with your medical team. Don't be ashamed to talk to your doctor about this so that they can help you determine what the best treatment plan for you will be so that you can feel your best.